Welcome, everyone. I'm so excited. This is really, I was just writing Dr. Alex saying, I feel this is, I use the words cutting edge, bringing the two of you together is really special. It's something that we've been working on together to bring this to the forefront. We felt having a medical oncologist and a pharmacist together would be amazing and fantastic. So why don't you guys introduce yourselves? So for those that don't know who you are.
Yeah. I'm Dr. Rahul Singh, board certified medical oncologist, hematologist. I'm proud to be part of Learn Locate. I practice out of community practice in Northern Virginia, D.C. area.
It's amazing. And you've been with me from when?
From the beginning.
From the beginning. When we're both just kind of hanging out on Instagram, right, trying to figure our way, right?
Right, exactly.
Yes. And Dr. Singh has been extremely helpful on social media, trying to bring all of this information to the forefront. And your compassionate way of delivering your message is very welcomed by many people all over the world. And Dr. Alex, could you introduce yourself?
Yes. So I'm Dr. Alex Cosimano. I'm a board certified specialty pharmacist with Walgreens Specialty Pharmacy, and also have a little bit of experience working in oncology infusion.
And you joined the Learn Locate medical team with us about
earlier this year.
This year, yes. Yeah. And we've gone live a couple times, and having your perspective is just extremely important for so many of us. So thank you both for being a part of this much needed global movement. And tonight we're really going to address the topics on how, medication plays such a big role in a breast cancer person. Some of us don't have to take it and some of us do, but we'd really like to address some of the key questions that most of us have, as far as maybe, for instance, I'm just going to throw out the tamoxifen question that comes up quite a bit. There's a lot of side effects with endocrine therapy, and we all have the question on, why can't we take a lower dose, or, aren't there more studies? Can we talk a little bit about, the advances that are being made with endocrine therapy and how this relates to, from the pharmacy world and then the oncology world, what your perspective is on all of this? And I don't know who wants to take this first.
Right. I think just overview, tamoxifen is one of the endocrine therapies that we use to treat hormone-positive breast cancer. So that's estrogen or progesterone-positive breast cancer. And that could be early stage, or if it's spread, stage 4 disease. That's one class. There's another class called aromatase inhibitors that we use. But tamoxifen, generally for premenopausal women, are used almost exclusively a lot of times. And so they do have several side effects. And, I think we've kind of addressed this a lot, but understanding what you're going on, even though it's not a chemotherapy, has several side effects, and knowing what those side effects are, it kind of helps understand when you're on therapy what to look out for. And thankfully, we have a wonderful pharmacy team that can actually help us with this. As oncologists, I always say that, when we're in the room with the patient, we only have a limited amount of time. Yes. And so we try to go through as much as we can, but it requires a team to really drive that home. And a lot of times patients come in not having all the questions thought through, or have questions when they leave. And so that's what we are here for, is to try to help with that. So Alex, Dr. Cosimano, if you want to jump in.
Yeah, sure. So I think from the pharmacy side, we really want to help you learn what to expect and then just how to manage through it, right? So we know that most women that take endocrine therapy are going to at some time have hot flashes and experience other side effects with that. So just being prepared, like Dr. Singh said, knowing what to expect, I think, is like the first half of the battle, right? Mm-hmm. But then and so one of the great things that we do, especially pharmacists, is really work with the patient to develop a personalized plan of how they're going to address those side effects. So what might work for one patient may not work for another patient, but we're here to help you work through those and decide what approach is best for you. And then also, when is it time to talk to my oncologist about maybe trying another medication that can help address the hot flashes or whatever else is going on, if all the self-care things that we can recommend aren't working.
Can you talk a little bit about that? I love hearing about a map. I think one of the things that we really want to address this evening is the fact that a pharmacist can be a really big part of our breast cancer journey. And that, this is all news to me. I never would have thought of this until working with all of you at Walgreens. And I'm really glad that we can bring this to the forefront, because you are a resource that is so valuable and available. There's not a 9 to 5 call, things shut down. There's a lot of interaction and a lot of care that goes into helping us. And I really wish I knew this 5 years ago. So can you touch a little bit on that? Dr. Alex, more about the mapping. Do you literally would say how long do you see these side effects, and if you're seeing them for this amount of time? Can you get into that a little bit?
I mean, it really depends on what side effect we're talking about, and we all know side effects can come and go, right? So you may have some really bad days and you may have some better days, but we just like to give the patient strategies based on what they're telling us is going on. So for a woman experiencing hot flashes, maybe they're experiencing them more at work than they are at home because the temperature is not controllable. So we might advise dressing in layers, right? I advise having a cold compress handy if it's something where they can have that, just to help cool them off. And we will go through different strategies with each woman or to make sure that it's something that works for them. And if we exhaust all those options that we have without turning to prescriptions or other medications that would require a doctor's intervention, then we can help them prepare for that conversation with the doctor. These are some of the medicines you may want to talk to your doctor about. They can help with the hot flashes. These are the ones that won't interact with your other medications, whereas some of the other choices interact. We can, the class of medicine might have less side effects or might help with other symptoms they're experiencing. Like, for example, one of the types of medicine we use are antidepressants. So if a woman has anxiety along with their depression, we might go with an antidepressant to help alleviate both those symptoms and the hot flash symptoms. If it's a woman that's been on chemotherapy before and they have neuropathy or nerve pain, then maybe we'll use the medicine that can help address those symptoms along with the hot flash. It just really depends on the specific woman's case and what's most appropriate. And we can help them prepare for that conversation with the doctor, because of course it would have to be prescribed by the physician.
I think that's very valuable, right? So as oncologists, when we're seeing a patient, a lot of times it's not just recognizing, it's developing a care plan. And I think that is very valuable, because a lot of patients don't know what to ask or what symptoms to point out, or even honestly provocative conversation. So coming into the oncologist's office and saying, well, talking to my care plan from Walgreens Pharmacy or whoever it may be, really helps us kind of focus the attention in that time frame that we have to really focus on how do we address those issues. I think it's very valuable.
Both of you, just the coordination of what Walgreens specialty pharmacies can do for a breast cancer or any cancer patient is so special, because the unique fact that you guys are trained specifically in oncology, so truly understanding these unique medications. And I know, Dr. Alex, you've taught me that Walgreens specialty pharmacies sometimes carries medications that other pharmacies don't carry. Can you touch on that? And Dr. Singh, before we go there, Dr. Alex, I just want to ask you, did you know any of this? Did you know that?
No, so prior to talking to you about it, Cynthia, unfortunately, we didn't know about that. And I obviously did the research afterwards, and there is a Walgreens specialty oncology pharmacy not too far from us now. But I feel it's an untouched resource, honestly. Yes. I think patients could really value using that, because it's different than your average pharmacist that you go to the local grocer for. You're specialized in what we need you to be specialized in, and I think that's what's impactful. And it goes beyond the medications. I think that's the big thing about it. So my mind was blown when I found out about this, and obviously I'm very excited about it.
Yeah, I think that's what we're trying to do here. I mean, if two people tell two people and tell two more people, and hopefully come to the Learn, Look, Locate beautiful page that we have dedicated to, and that's only just a scratching of the surface, since, as you and I know, what's available. And I think talking about it, Dr. Alex, when you taught me, we go to a specialist when we have a special situation for a doctor, and that's kind of what you guys are. You're really truly focused on this, the oncology, part of what we're dealing with. And so just picking up my tamoxifen at a regular pharmacy is just, it just is. But having the care and the coordination is really important. I forgot the question I was going to ask Dr. Alex. What was it?
Well, I think touch on that for a minute, right? Because it's so important to understand that it's more than just your every corner Walgreens or pharmacy that you might see on the streets, right? We really get a lot of extra training and have a lot of extra resources available at our disposal to give the attention to the patients that they need in these situations. So whether it's counseling sessions, whether it's documenting those care plans, getting that documentation over to your doctors so that they know what's going on with you and they're prepared for that kind of appointment with them, or helping you find financial assistance for medications. And then I think we were going to touch on limited medications that are only available through specialty pharmacies.
Yes.
So it's definitely true. You can take your tamoxifen pharmacy. It's not a limited medication, but some of the newer medications for there definitely are limited distribution medications, which are only available through certain specialty pharmacies.
Yeah, and so Dr. Singh, now that you know that, I'm sure with the coordination factor, that's really helpful. So if there's a newer drug that is off of clinical trials or something like that, and or not off of clinical, but available for for people to use, having this resource and this access is probably really helpful, right?
Absolutely. So I think you're referencing those newer drugs, CDK4/6 inhibitors, which we use in metastatic breast cancer. There's several of them. The most common one is the Ibrance, but there are several. And so that's a special drug that you can't pick up from every pharmacy. And so having that dispensed, but also having the knowledge dispensed with it makes a huge difference for us.
Yeah, I would imagine. I mean, some of the more, I don't want to use the word aggressive, but drugs that need the kind of human touch and care that you're talking about behind it, right? So someone's really, and really, as an oncologist, let's talk about kind of the emotional. You're unique. You have an emotional connection with your patients. You seem to understand that these side effects can be so hard on people. And there really is an emotional crossroad, quality of life or take the drug. And Dr. Outs, we've had these conversations. It's really important, even as you said earlier, to know that there's other alternatives. But I think the human compassion around discussing this is lost. It was for me. Can we talk about that?
Yeah, I think first of all, it's important to give the floor to the patient. So meaning hear them out, ask open-ended questions to understand really how has their life been, and honestly, quite frankly, how has their life changed since they've been on the medication, right? It's not always about focus questions. I think that's the more important part to look at. And so people might not think, as we were talking about the other day, someone who's active that's all of a sudden starts getting joint pain, a little bit more that's affecting, and they might be an avid tennis player and all of a sudden they feel they can't play 3 sets or 2 sets, and subtle things that they may not notice, they overlook, but that joint pain could be due to their anastrozole that they're taking or their letrozole that they're taking, and not knowing that. And so trying to understand your patient, because every patient's unique, maybe not everybody's fit. You have to understand what's off for them to then dig into it to figure out, is that a side effect? Is that something, general arthritis? So I think their sexual function, are they active? Are they experiencing vaginal dryness? Is there vision changes because tamoxifen can cause X, or these are the things, or are they having pain in their leg because we know tamoxifen can cause blood clots? I mean, they're spotting more from their menstrual cycles when they shouldn't be. These are all things that you kind of have to let the patient talk first to understand what they're experiencing, and then asking specific questions. So I think as an oncologist, trying to understand each patient is different, and then teasing out what's bothering them or may not be bothering them.
Yeah, I mean, Dr. Outs, can you touch on that a little bit, just as from the pharmacist perspective?
Yeah, so I think when we first counsel patients when they're trying a new medication, at least my approach I like to take is to first go over all the common side effects that they're more likely to experience, right? And then if it's we know that, for example, Xeloda, a medication that's used in metastatic breast cancer, it can cause dry, itchy palms and itchy soles of your feet. So we proactively will advise, go ahead and start using good moisturizer several times a day. So just little maybe help prevent side effects. And also, what's serious and requires a call to the doctor right away, right? Because it's scary and overwhelming to read those prescription labels and see this medicine can cause blood clots, it can cause you to lose your immune function, it can cause this, that, and the other thing, right? Would scare anyone. It scares me as a pharmacist to think about that. But if we're prepared with, we know that, well, hey, if I start to feel that pain in my leg, I need to call Dr. Singh right away. Or if I start to notice I'm bleeding or bleeding not associated with my administration, I need to call Dr. Singh right away because that's a serious side effect. So if we are empowered with that knowledge of what's serious and needs medical attention right away versus what's expected and more common and what we can do to help those things when they occur, I think it just empowers patients to take their own healthcare, and to really feel more confident in what they're doing, what they're putting into their body.
Yeah. Yeah. Any thoughts on that, Dr. Singh?
Yeah, I think that's beautiful. No, I mean, because it's not just, we're focused, a lot of times we focus in on hormone positive breast cancer, which is 2/3 of breast cancer, but there's a whole nother world of people who are on chemotherapy, whether that's oral chemotherapy or IV chemotherapy or even non-chemotherapy drugs. And so I think keeping track of all of this and understanding, as you said, I mean, I tell people, if you ever looked at the FDA label for aspirin, it's really scary. And that's a basic drug that a lot of people take. Imagine reading through these FDA labels. It's very, very scary. So I think that's great. I mean, again, so as oncologists, we try to hit the high level stuff, but you're right. I mean, there's a lot to cover. And I think getting it repetitively from different sources really helps. And accurate information, right? There's a lot of information out there that's misinformation. And so I think getting accurate and good information such as this is.
You bring up a really good point. So when I was, told to take tamoxifen, and I'm sure people can relate to this, what do? Well, we're going to go Google. And then we're going to read about all the people talking about the side effects. And then we're going to scare ourselves out of it.
Yeah.
Literally. And that is something that's so interesting because I recently had a situation where I had to take some prednisone. I'm so embarrassed to say, but gout in my little toe, which I have no idea how I got it, but it was the most excruciating, painful thing in the world. And I didn't even look at the side effects of this prednisone that I had to take. I was like, I'm in so much pain. And I just weathered through because I didn't want to know. And so I think that is a big problem. I'm sharing this personal experience just because I knew I needed to get to the other side because I was in so much pain. But I think we need to know that each person is different. And I post quite a bit about tamoxifen. And we have a new page coming out with Dr. Singh on tamoxifen, which is really gorgeous. I can't wait to show it to you. And really talks about, all the benefits, but also we're realistic about side effects. But some people have absolutely no problem with it. And, when you reach, I guess it's postmenopause, after, there's choices, right? So I think that knowing that is really important and being able to say that I might not have a reaction, right?
Right. I mean, knowing where your options are. A lot of times, unfortunately, the old school mentality of oncologists where you walk into the doctor's office and you're told what you're going to take, right? I mean, that is not the way it should be. And the way it is now is, yes, if you're postmenopausal, you have a lot of options, and they should all be discussed with you. And quite frankly, you should get all that information from everywhere and trusted sources, I think. And so, yeah, I think medicine's evolving for the better. I really do believe so. And now we have great information sources to get that to us.
I'm going to ask a question that came up on another platform about tamoxifen, and I don't know if you're able to answer it, either one of you, but I know I felt this way myself, that the dosage being so high, and studying and reading about other countries where other women are taking lower dosages. I'm not sure if this is an okay question to ask, but I really, as I do this work, know that there's advances being made, and I see this as an area where there could be, why isn't there more research on drugs that are not causing so many side effects, or can we take lower doses? So just want to throw that out there.
Yeah, I think there's some research on using tamoxifen at a lower dose in non-breast cancer, so DCIS, like stage 0 breast cancer.
Okay.
not to my knowledge, is there data in the U.S. for breast cancer and dose reduction of the tamoxifen. But having said that, I have seen it done. I can't speak for what's done in other countries, but certainly I think, yes, that's an area that should be researched. I think the problem with generating a trial like that is it's unfortunately not provocative enough for drug companies. Unfortunately, that's the society that we live in, that it's not, and I mean, this is an open platform, so I can say this, I don't think it's going to generate revenue for the people that are providing tamoxifen. And so the answer to the question is, there probably is a better dose of tamoxifen that we don't know, and we should know, but I don't know who's going to study that, you know. And so prescribing off-label tamoxifen for someone who has breast cancer at a lower dose is a little bit tricky. It's a little bit murky as an oncologist, unfortunately.
I just felt bringing kind of the realness from this side. You guys don't know, you know.
No, and I have patients who come in and ask about that very question, and it's a hard one to answer. I do hear you.
You guys are in a tough spot as well, you know. Go ahead, Dr. Alex. I can't see you.
I think Dr. Singh is absolutely right. I think also, like, when you know you have something that works, you know, at least to whatever extent, it may not be always the most ethical decision, right, to recommend something that's experimental versus something that you have
of course.
That works, right? So it is difficult, but that is always evolving. The whole paradigm that we've had in cancer treatment is always throw as much as we can at it that won't too badly damage the patient, right? So we've always started at the highest dose of drug and worked our way down, right? Whether it's chemotherapy, oral targeted therapy, immunotherapy, whatever the case may be, we've always started out like, how much can we throw at the patient that they can handle? And then if they can't handle it, we'll work our way down. I think we're starting to slowly see the paradigm shift in clinical trials where we're starting patients at lower doses, seeing if that's sufficient, raising the dose only if we need to or after we've demonstrated they can tolerate the lower dose. We're even starting to see more and more doctors treat patients that way off-label as confidence is gained in that method, right? So not to apply that specific tamoxifen, because I'm not speaking much more broad terms here, but I think it is a good time for the future that paradigm is starting to shift where we're seeing doctors and clinical trials conducted that way.
Yeah. I want to ask each one of you kind of separately, in a perfect world, how would you envision an oncologist working closely with a pharmacist? Now that you know about specialty pharmacies, and Walgreens specifically, Dr. Singh, what would you do differently in the sense of the coordination of care and how to make a patient feel? I'm going to tell you how I feel, just, and then I'm sort of prompting you a little bit, I guess, but there's a journey where you're being carried all the way through, right? Because we really do feel alone when we leave the oncologist's office. We're like, I need more. I'm not there yet. So your thoughts?
Yeah, I think it's very helpful because as I started off this conversation, we have a finite time in the room where we have to give a diagnosis, explain a treatment plan, and be empathetic in the whole sitting. Right, it's a lot to cover, and it's. I mean, a lot of patients are deer in headlights, and rightfully so. It's hard, and so understanding this care team, which I think is, if that's the right way to put it, it's like a village. And so now knowing that I can not just hand off, that's not the right term, but basically bridging that gap with the Walgreens pharmacist, specialty care pharmacy, really helps me because I know I'm prescribing a medication to someone who then can turn around and educate somebody as well, what I'm doing, and continue to follow that patient when I can't see them every day. And then when I circle back to see me, we've got a great team together to help me guide. Do we need to reduce the dose? Do we need to manage side effects? Do we need to change therapy? It's great. I think it's practice changing, to be quite honest.
Wow. And so all this time, you've never had that kind of opportunity to bring things to that level, correct? Is that right?
Right. No, definitely not. We would just write it off to another pharmacy, and then, they would call back, and we would have a lot of interaction, and then we'd have a 3-month follow-up, and that's it, right? And then that visit that we have to see them in 3 months, a lot is tried to condense into one visit again. Wow. And so it's not fair, I think. So
You know what,
this is great.
Dr. Alex, before I just want to touch on that is it's a piece of paper, it's a prescription, and that's it.
Yeah.
And now there's a human behind the prescription, correct? It's kind of what you're saying.
Correct. Right. A human and a team. I think that's the best part about it. Yeah.
Yeah. And Dr. Alex, can you tell us a little bit more when the whole team and just the resources and all of that? It's really lovely to continue to talk about so that people know.
Yeah, I think what really separates us, what sets us apart from most specialty pharmacies is most specialty pharmacies are a centralized location where from across the all the prescriptions are sent into one pharmacy and mailed out to the patient, which is great for having, a centralized place with a team of experts, but it's not so great to building a relationship with one pharmacist or one team of pharmacists. And it's not so great for a place where a patient can walk into and speak to their pharmacist face to face. But that's what makes Walgreens Specialty Pharmacy different, because we offer that. But in addition to that, we offer all these different specialty pharmacies in the communities where the patient and doctor are, sometimes even in the same building or same medical center where they're practicing. So this way the patient can go straight to the doctor's office, to the pharmacy, have this. If it's a medication that does not require special authorization insurance, they can maybe even walk out with the prescription right then and there. Oftentimes we do have to get a special authorization from the insurance company, and we have to figure out the payment and how to help patients afford the medication. So those things can take a little bit of time, of course. But just having that ability to have an actual brick and mortar pharmacy where you can walk in and speak to your pharmacist one-on-one, I think is really And that team of people, the doctors constantly communicating with the same people in the pharmacy, just like you constantly communicate with your doctor and a team of professionals at your doctor's that you've become familiar with. You'll know your pharmacy team first name basis too when you use a Walgreens Specialty Pharmacy, because we have a small intricate team that really specializes in what they're, the oncology, and is going to help the patient every step of the journey.
Walgreens Specialty Pharmacies, I just want to address, is oncology focused. So it's not just breast cancer. So for anyone that's on this evening, really understanding that any type of cancer, correct?
Yeah.
I just want to draw
And there are other conditions that require specialized medications like multiple sclerosis, fertility medication,
fertility,
arthritis. There's a whole range of disease states that we specialize in, and then we have different pharmacies that specialize in the different disease states.
Can I touch on fertility? I don't know how much time you guys have, but I really think it's really important because there's a lot of young breast cancer survivors that are part of the Learn, Look, Locate movement here. And if they're diagnosed with breast cancer and want to start a family, like, wow, I went through fertility myself in my 30s, IVF 3 times. I didn't have breast cancer. I can't even imagine. So the education just around that is so unbelievable. And I'm sure, Dr. Singh, you deal with young patients, and the education is, what your thoughts on this? I don't want to.
Yeah, I think a lot of times the hardest part is the young patients who need to have chemotherapy, either before or after surgery. And so fertility preservation is the most paramount conversation you need to have with a young female. And so I think we have a close network here where as soon as I can identify that person, I'm already making phone calls. And then when I walk into the room, I'm armed to have that discussion simultaneously. Because, and thankfully, I've had numerous patients get through treatment and get pregnant afterwards, but you need to be upfront and honest. And if you need to, you have to delay treatment until they can get that done. I think that makes a big difference. And so, again, that's why I say it's a team. It's not the oncologist. It's not the pharmacist. It's everybody that really plays a role.
Yeah. And Dr. Alex, real quick, because I don't want to keep you guys, I know it's late, but if you could touch on what and how Walgreens Specialty Pharmacies really can help in this area, which is really special.
Yeah, so we all know that fertility treatment is very expensive, often not covered by insurance, although thankfully more and more insurances are starting to give coverage for it. But we work with various pharmacies manufacturers and foundations to provide fertility medication. And oftentimes with our Heartbeat program, patients can receive it at no charge if they're eligible. So know that's great. Something to get started right away, like Kristen said, be upfront with your doctor that in, or even potentially interested, right? Because if you think you might want to start a family in the future or expand your family in the future, we need to know before you start treatment.
Yes.
Take those steps before treatment starts. So it's definitely something to bring up at that first doctor's visit.
So much that we have to process. You guys, it's a whole new language. I just did a post about that. ER positive. Nobody knows what this means. Then you've got to be dealing with, fertility and reconstruction. It is a lot. So that's why we are trying to have these open conversations. And I save these and I edit them and we put them out there in kind of bite-sized pieces so that people can just take it, because we're all so busy and we want to be able to digest the information, but we need it. And this is really valuable, both of you. So I really can't thank you enough. Thank you, Walgreens Specialty Pharmacies, for all that you're doing to help everyone going through this challenging time. I mean, it really is very hard, and knowing that you're out there with these resources, I want to do everything I can to help bridge this gap, not only with the community, but with the oncologists, because
No, I think this is invaluable. I mean, thank you, Cynthia, from Learn to Locate. I mean, thank you, Walgreens, Dr. Alex. You guys are awesome. I think this is much needed.
Yeah.
I mean, just coming from an oncology standpoint, I think this is amazing for patients. It really is.
Thank you for saying that. That's really it. And the fact that we're working together, I think, as you guys saw me promoting this, I think, you can't get much better than having the two of you in here to, we didn't even open the floor up for questions. Anyone? We had a bit of a small crowd this evening. It's been a hard month for many of the survivors, I think. We've just been inundated, and we're trying to, keep going with what we're trying to do here. But does anyone have any questions for the doctors? No? I think that's it, guys. Unless Dr. Alex, any last thoughts?
No, just thank you both for the collaboration. I think this was awesome to get to see something from a patient perspective, a doctor perspective, and it just really shows how important the circle of care is. And we all have to work together to help patients get their best outcomes and continue living life the best they can.
Yeah, I love that circle of care. Really, I brought the edgy question of, the tamoxifen, and then we've got, we've got all perspectives here. So that's a nice way of putting it.